Anticholinergic.
An anticholinergic agent is a substance that blocks the neurotransmitter acetylcholine in the central and the peripheral nervous system. Anticholinergics inhibit parasympathetic nerve impulses by selectively blocking the binding of the neurotransmitter acetylcholine to its receptor in nerve cells. The nerve fibers of the parasympathetic system are responsible for the involuntary movement of smooth muscles present in the gastrointestinal tract, urinary tract, lungs, etc. Anticholinergics are divided into three categories in accordance with their specific targets in the central and/or peripheral nervous system: antimuscarinic agents, ganglionic blockers, and neuromuscular blockers.
Pharmacology.
Anticholinergics are classified according to the receptors that are affected. Antimuscarinic agents operate on the muscarinic acetylcholine receptors. The majority of anticholinergic drugs are antimuscarinics. Antinicotinic agents operate on the nicotinic acetylcholine receptors. The majority of these are non-depolarizing skeletal muscle relaxants for surgical use that are structurally related to cure. Several are depolarizing agents.
Examples.
Examples of common anticholinergics: antimuscarinic agents: atropine, benztropine, cargentin, biparidone, chlorpheniramine, clitrimetin, dicyclomine, dicycloverine, dimenhydrinate, dramamine, diphenhydramine, Benadryl, Suminex, Advil PM, etc., doxylamine, Unizom, glycopyrrolate, Robinal, ipratropium, Attribution, orphenadrine, excitropium, oxyvant, oxybutynin, ditropan, dryptane, Lirinol XL, tolterodine, Detrol, detrucitol, sheetopium, Spiriva, trixifenadil, scopolamine, solifenacine, tropicamide, atropine, benztropine, cargentin, biparidone, chlorpheniramine, clitrimetin, dicyclomine, dicycloverine, dimenhydrinate, dramamine, diphenhydramine, Benadryl, Suminex, Advil PM, etc., doxylamine, Unizom, glycopyrrolate, Robinal, ipratropium, Attribant, orphenadrine, excitropium, oxyvant, oxybutynin, ditropan, dryptane, Lirinol XL, tolterodine, Detrol, detrucitol, sheetopium, Spiriva, trixifenadil, scopolamine, solifenacine, tropicamide, anti-nicotinic agents: bupropion, Zaban, Wellbutrin, ganglion blocker, dextromethorphan, cough suppressant and ganglion blocker, doxycurium, non-depolarizing skeletal muscular relaxant, hexamethonium, ganglion blocker, mecamulamine, ganglion blocker and occasional smoking cessation aid, tubocurarine, non-depolarizing skeletal muscular relaxant, bupropion, Zaban, Wellbutrin, ganglion blocker, dextromethorphan, cough suppressant and ganglion blocker, doxycurium, non-depolarizing skeletal muscular relaxant, hexamethonium, ganglion blocker, mecamulamine, ganglion blocker and occasional smoking cessation aid, tubocurarine, non-depolarizing skeletal muscular relaxant. Plants of the Solanaceae family contain various anticholinergic tropane alkaloids such as scopolamine, atropine, and hyoscyamine. Physostigmine is one of only a few drugs that can be used as an antidote for anticholinergic poisoning. Nicotine also counteracts anticholinergics by activating nicotinic acetylcholine receptors. Caffeine, although an adenosine receptor antagonist, would counteract the anticholinergic symptoms by reducing sedation and increase acetylcholine activity, thereby causing alertness and arousal.
Medical and recreational uses.
Anticholinergic drugs are used in treating a variety of conditions. Gastrointestinal disorders, for example, gastritis, diarrhea, pyloryspasm, diverticulitis, ulcerative colitis, nausea, and vomiting. Genitourinary disorders, for example, cystitis, urethritis, and prostatitis. Respiratory disorders, for example, asthma, chronic bronchitis, and chronic obstructive pulmonary disease. Sinus bradycardia due to a hypersensitive vagus nerve. Insomnia, although usually only on a short-term basis. Dizziness, including vertigo and motion sickness-related symptoms. Anticholinergics generally have antisialagogue effects, decreasing saliva production, and most have at least some sedative effect, both being advantageous in surgical procedures. When a significant amount of an anticholinergic is taken into the body, a toxic reaction known as acute anticholinergic syndrome may result. This may happen accidentally or intentionally as a consequence of recreational drug use. Anticholinergic drugs are usually considered the least enjoyable by many recreational drug users, possibly due to the lack of euphoria caused by them. In terms of recreational use, these drugs are commonly referred to as deliriants. Because most users do not enjoy the experience, they do not use it again, or do so very rarely. The risk of addiction is low in the anticholinergic class. The effects are usually more pronounced in the elderly, due to natural reduction of acetylcholine production associated with age. Exceptions to the above include scopolamine, orphenadrine, dicyclovarine dicyclamine and first-generation antihistamines with central nervous system penetration.
Acute anticholinergic syndrome.
Possible effects of anticholinergics include ataxia, loss of coordination, decreased mucus production in the nose and throat, consequent dry, sore throat, xerostomia or dry mouth with possible acceleration of dental caries, cessation of perspiration, consequent decreased epidermal thermal dissipation leading to warm, blotchy, or red skin, increased body temperature, pupil dilation, mydriasis, consequent sensitivity to bright light, photophobia, loss of accommodation, loss of focusing ability, blurred vision, cycloplegia, double vision, diplopia, increased heart rate, tachycardia, tendency to be easily startled, urinary retention, diminished bowel movement, sometimes ileus, decreases motility via the vagus nerve, increased intraocular pressure. Dangerous for people with narrow-angle glaucoma, shaking. Possible effects in the central nervous system resemble those associated with delirium, and may include confusion, disorientation, agitation, euphoria or dysphoria, respiratory depression, memory problems, inability to concentrate, wandering thoughts, inability to sustain a train of thought, incoherent speech, irritability, mental confusion, brain fog, wakeful myoclonic jerking, unusual sensitivity to sudden sounds, illogical thinking, photophobia, visual disturbances, periodic flashes of light, periodic changes in visual field, visual snow, restricted or tunnel vision, periodic flashes of light, periodic changes in visual field, visual snow, restricted or tunnel vision, visual, auditory, or other sensory hallucinations, warping or waving of surfaces and edges, textured surfaces, dancing lines, spiders, insects, form constants, lifelike objects indistinguishable from reality, phantom smoking, hallucinated presence of people not actually there, warping or waving of surfaces and edges, textured surfaces, dancing lines, spiders, insects, form constants, lifelike objects indistinguishable from reality, phantom smoking, hallucinated presence of people not actually there, rarely, seizures, coma, and death, orthostatic hypotension, sudden dropping of systolic blood pressure when standing up suddenly, and significantly increased risk of falls in the elderly population. A common mnemonic for the main features of anticholinergic syndrome is the following: hot as a hare, hypothermia, blind as a bat, dilated pupils, dry as a bone, dry skin, red as a beet, vasodilation, mad as a hatter, hallucinations, agitation, the bowel and bladder lose their tone and the heart goes on alone, ileus, urinary retention, tachycardia.
Remedies.
Acute anticholinergic syndrome is completely reversible and subsides once all of the causative agent has been excreted. Reversible cholinergic agents such as physostigmine can be used in life-threatening cases. Wider use is discouraged due to the significant side effects, such as rapid heartbeat and decreased blood pressure. Piracetam, and other acetams, A GPC and choline are known to activate the cholinergic system and alleviate cognitive symptoms caused by extended use of anticholinergic drugs.
Plant sources.
The most common plants containing anticholinergic alkaloids are Atropa belladonna, deadly nightshade, source of atropine, Brugmansia species, Brugmansia, Datura species, Datura, Hyoscyamus niger, henbane, Mandragora officinarum, mandrake.
Use as a deterrent.
Certain preparations of some drugs, such as hydrocodone, are mixed with an anticholinergic agent to deter intentional overdose.